Good afternoon. Thank you so much for joining. We'll get started in just a moment or two. Good morning, everyone. Thank you for joining. We'll get started just in a moment or two. Thank you for your time. Don't worry, I don't have COVID.
Oh, that's an icebreaker.
Right?
There you
My
go.
little cough. All right, we definitely have people coming in. Just we'll give it a moment or two for everybody to get onto the call, and then we'll get started.
Oh. Great.
All right, it does look like we have a handful of folks that are on the call. So let's get this party started. All right, good afternoon, everyone. I'm Lori Brednick. I'm the CEO and founder of HR Company Store. HR Company Store is the Angie's List or Yelp website for the HR industry. HR professionals can find vendors in all different categories, from absence management to workers' comp. And you can see how your peers, other HR professionals, rate and review the products and services they receive from these vendors. Think of it as a quick and easy reference check website for vendors. So if you're an HR professional, please contribute to our community. And you can do that for free for registering. And just when you register on a website, you can also rate and review your favorite vendors. And just know that every time you do a review, we donate $1 to charity. So currently we're partnering with the ASPCA and Dress for Success. So really your opinion does make a difference. I'm excited today to announce that for the HR Company Store Vendor Showcase, we're having a panel discussion with Johns Hopkins HealthCare Solutions and Agile Edge Health. Both of these organizations are leaders in the employee well-being space. And today they'll be providing their insight into achieving organizational resiliency and vitality in the pandemic, looking out for those third and fourth waves. But before I introduce these folks, just a quick few housekeeping items for you. First, you may notice you're on mute. If you have any questions, please drop them in the chat box and we'll address them at the end of our conversation. If we run out of time, we'll make sure someone gets back to you and directly answers your questions. And then second, you should have all the documents that we're covering today. They were sent out via email. If you don't, please check your junk mail folder. If you still don't have them, please email support@hrcompanystore.com and we'll resend them to you. So now let's get started. We have an amazing group of panelists for you today. First, I'd like to introduce Joe Checkley. Joe is a senior advisor for both Agile Edge Health and the National Alliance of Healthcare Purchasers Coalition. Joe is a 35-year veteran benefits executive who has held global leadership positions at organizations such as Allied Signal, American Standard Companies, Train Corporation, and Quest Diagnostic. Next, we have Sarah Kacher. Sarah is part of the Population Health Analytics Leadership Team at Johns Hopkins HealthCare Solutions. She's responsible for a portfolio of analytic products and engagements, providing real-world business analytics and actual expertise within the institution and solutions external to customers. Up next is Stuart Sutley. Stuart is a leader of business development at Johns Hopkins HealthCare Solutions. He works with over 100 employers throughout the country to design, develop, and implement programs and on-site clinics that leverage the Hopkins evidence-based research and clinical experience for providing whole person support for individual well-being improvement. And last but not least, we have Tony Merlot. Tony is the Chief Knowledge Officer at Agile Edge Health and brings to the company over 25 years of experience in population health management and individual well-being improvement. So thank you all for taking the time to be featured on the HR Company Store Vendor Showcase. Now let's get started. Sarah, let's start with you. Please describe what Johns Hopkins is doing generally to support communities and organizations to respond to the COVID-19 crisis and the types of resources that are available for free to everyone.
Sure, thanks, Lori. So as we all know, Hopkins is a leader in the space of pandemic response. Our School of Public Health, and particularly our Hopkins Center for Health Security, have been leading the way in information gathering, research, and response from the start of the pandemic. On the left side, you have probably all seen this map before, but we have a Hopkins developed and maintained resource to understand the prevalence of virus spread and response within your local community. That's one that's available for free at the links at the bottom of this slide. There are also a number of employer and school specific resources, as well as guidance and best practices for pandemic response, easy to use toolkits and resources from our Center for Health Security. So there's quite a bit in that space, and I would really encourage you to check it out.
Wow, that is amazing. I didn't know that all that was available and for free. Go figure. All right, Stuart, you're next. Please describe specifically how Johns Hopkins Healthcare Solution partners with employers and ways you've supported them in the past few months in responding to COVID.
Sure. Thanks for the question. So a number of ways we've been dealing with existing clients, but also opportunities which have developed with prospects and companies that are looking for additional support. So we have, as you mentioned, we have a lot of clinics around the country. One of the ways we've been helping our clients is that some are essential businesses and have had to continue to operate during the pandemic. So we've been there to help them with advice around strategy, around how to keep employees healthy. We've taken a lot of our clinicians online and they've been doing virtual care. And then we also have a lot of clients who have people working from home. So we have been supporting those clients with lots of information about stress, resiliency, how to deal with, working from home, but also programs to support people at home. So we have a mental health program, some pre-diabetes, diabetes program, cancer advocacy program, all which are digitized and can be used remotely. So that's been of great benefit. In addition, we have a company that was launched by Hopkins called Emoca Health. It's a standalone company, but it was developed by intellectual property from Hopkins for basically direct observation therapy. We have, Emoca has taken their application and has actually developed a symptom monitoring application for employees to use remotely to check their symptoms prior to coming to work. And again, that's a huge benefit when you think about, you don't want people showing up at work with issues. You want to try to catch them at home. And if they do, then we reach out to them, give them guidance, what the company policy is, et cetera. So all of this kind of pulls together to say that what we've really been focused on through, again, as Sarah said, a lot of the free resources from Hopkins, but also other guidelines like OSHA, CDC, how to help companies build the best safety net they can, because it's not a one size fits all. There's no silver bullet. So it's really putting a lot of these pieces together to form a strategy.
Awesome. Awesome. Thank you so much. I mean, it's great to hear that Hopkins is really leading the charge in this new world that we're in, creating tools and resources for employers to implement. That's awesome. All right, Tony, you're up next. Please describe what is Agile Edge Health and its mission.
Thanks, Lori, and good afternoon, and thanks to everybody for attending today. Agile's a team of senior advisors and IT applications developers who've come together because we share a commitment to improving individual, organizational, and community well-being. And we do it through partnerships with organizations like Johns Hopkins Healthcare Solutions, MVitals, Synergic, Health Next, and many others, where together we want to enable employers and health systems to achieve world-class outcomes for their populations through a mix of facilitating culture change and helping to execute new strategies and service delivery models. We're very excited at Agile to be a new partner with HR Company Store. and to be able to bring to these showcases, as we did Vitals last week, Hopkins this week, and other partners in the coming months. So just greatly appreciate the opportunity and the partnership.
Yes, thank you. We totally appreciate it too. And it's good to know that you're available to help put all the pieces together for employers. So that's an awesome thing. All right, Joe, can you describe what is the National Alliance of Healthcare Purchasers Coalition and the Wellbeing Initiative that you've been leading?
Yes, Lori, I can. And thank you. Thank you for the opportunity today. Good afternoon, everybody. I think it's afternoon everywhere for this call. So in addition to being a partner in Agile Edge Health, I also am one of the leaders of the Wellbeing Initiative that's been sponsored and facilitated by the National Alliance of Healthcare Purchaser Coalitions. First things first, the National Alliance, if you weren't familiar, is an umbrella group that kind of overlays the dozens and dozens and dozens of regional coalitions, employer coalitions around the country. So for example, the Northeast Business Group on Health, the Mid-Atlantic Business Group on Health, the Midwest or Memphis Business Group on Health, all of those. And there's just under 50 of those organizations that are a part of the National Alliance. And the specific initiative around whole person well-being is an acknowledgement that on any given day when an employee walks through your door or during this era of COVID, when they log on in the morning, the whole person is coming to work or the whole person is logging on. And what I mean by that is historically we in the benefits arena have had a real focus on the physical well-being or physical wellness of our employees. And I think over time we've come to understand that people, it's not just one dimension that we should be concerned with, there are multiple dimensions. And you can see illustrated in the slide, and this has been categorized by a number of people in a number of different ways. We focus on physical well-being, we focus on an individual's social well-being. So for example, in this era of COVID, are people feeling isolated, especially if they're working at home? Those become challenges for employers. Mental health is an enormous part of what we focus on in terms of individuals. And the idea is to help employers and other purchasers understand the totality of the employee, and then also understand once they understand the totality of the employee and what's necessary to help that employee optimize their performance, and then it's a goal of, okay, so what do we specifically have to do to help employers and help employees be the very best that they can be for their employer? And that's the Wellbeing Initiative. Thank you.
Awesome. Awesome. I keep saying awesome today. I don't know why. It must be the word of the day for me. All right, Sarah, you're up next. What are the 4 waves of the pandemic that are described in the background documents that were distributed prior to our discussion?
Sure, thanks, Laurie. So there are 4 waves of this pandemic that are being used by our public health professionals to understand, monitor, and plan the pandemic response. Right now, we are in the 4th wave, or in the 1st wave. We are dealing with the immediate impacts of the virus, and at a local and national level, handling sick patients, hospital capacity, and slowing the spread of the disease. We also have some patients and communities, as we've seen in the news, who have started to feel the impact of post-disease. So we've got patients who were in the hospital on respirators, and now they're in a recovery situation. So when we talk about a 2nd wave, we really mean those who are recovering, and the longer term impact that will have on our skilled nursing facilities and hospitals. Coming is a 3rd wave. We're starting to see this, but it has not really hit yet, and we'll talk later about a 3rd and 4th wave. The 3rd wave is the impact of conditions, chronic conditions, for whom people have not received care or deferred care because of the pandemic. So thinking about someone who may have newly diagnosed diabetes, but their diagnosis comes 6 or 12 months late because they didn't make it to the doctor. There are a number of examples of that we'll go through later in the presentation, but that's coming, and that's something that employers will really need to think about and start to consider in the coming months. Finally, we have a fourth wave of trauma and mental illness, complicated by economic challenges and potential job loss, which may or may not come with a loss of health benefits. That is starting to build. It's impacting right now our care providers, as well as those with mental illness who are at home who can't get care. And as we go through these three waves, we'll continue to see this mental health burden grow and grow. And that will be with us for some time, even after the immediate impact of the virus dissipates. So a lot to think about, and I'll turn it back to you.
Well, you're definitely right. That is a lot to think about. And since you did such an amazing job at answering that question, I have another one for you.
Sure.
What guidance can Johns Hopkins and Agile provide from its experience over the past few months in terms of what its resiliency in wave one it means and how employers can attain it?
Sure. So resiliency in wave one is what employers are thinking about today to determine and guide their impact to this pandemic. So employers are thinking about, is it right for employees to stay at home? When should we bring them back, and how do we bring them back most safely? Do we bring back healthy employees first while allowing exceptions for other employees to continue working at home? How can we make commutes safer for people? For example, are employees being exposed to virus if they have to ride a crowded subway? And then how do we adapt our workplaces to be as safe as possible and also mitigate any potential impact of a viral outbreak in one of our departments or having an employee test positive? So we've seen employers be very proactive about this in a variety of ways, and we expect to continue to see that over the coming few months.
Hey, Joe, do you have anything you'd like to add to that?
Yeah, Lori, thank you. You know, employers have been at this now for several months at least. And I think that actually, all in all, given what was thrown at them with the rapidity of what was thrown at them, I think they've behaved marvelously. I would just highlight a couple of different things and as a reminder. First, all employers are different. And the right solution for one employer is the right solution for one employer, right? And everyone has to chart their own course. And certainly we want to leverage commonalities and similarities and those sorts of things. But everybody is different, and their path, given the nature of their organization, the nature of the business they're in, the nature of the resources that are available to them, they need to chart their own course. I would reinforce that it really is about a continuous improvement process. And I grew up in this business a long time ago, but I grew up on Six Sigma in the business. And one of the things that Six Sigma instilled in me was the continuous improvement process. We're going to make mistakes along the way. This is a changing dynamic. We're relying on experts, and they are learning. We've never done this before, so the guidelines are evolving, and the public health pronouncements are changing, and what have you. And so I would suggest flexibility built around some principles for the organization, the organization's risk tolerance, so flexibility and a continuous improvement process to get this better. Because we are going to make mistakes and we are going to trip up, but we have to stay at it because this is not going away in the near term. The other thing, a couple other things I would say, hugely important. Can't do this alone. I think it's highly important that we leverage our key relationships with vendors. I think we can also look to the communities where we live and work, the agencies that are available, the resources that they make available, and we shouldn't be shy about looking outside the organization. And the last thing I would suggest is that because it is a continuous improvement process, we want to be measuring, we want to be monitoring, and we want to be reacting and adopting to the changing dynamic. But you know, the benefit folks that I know and I've been working with, they've been working hard at this, and so this is kind of a reinforcement with what I think is going on out there.
Yeah, it's
Lori?
definitely been a challenging time for HR professionals across the board. I completely agree with you on that one. So Stuart, would you mind discussing some examples with us?
Yeah, sure. As Joe said, we've got a very wide range of clients, from poultry producers to law firms to accounting firms and everything in between. So everybody's got to look at this differently. If you think about it, we've really exposed as a nation some of the challenges in our kind of food delivery system. You've got a migrant workforce. One of our clients, 1 in 6 employees have a driver's license. Think about that for a second. So you can't ask every employee to drive to work by themselves. They have to carpool. And then what issues does that challenge bring? So an organization like that has to really then focus in on, how they're going to do continual checks on people, continual symptom monitoring. One of the things I thought is a really good feedback from an employer standpoint is, if you're going back to work, don't bring all your executives back and put them in the same conference room. Think about it almost to how we talk about, not letting every executive in a company fly on the same airplane. Well, same thing around COVID. You can't put the whole C-suite together, and shouldn't. And then you also have to think through, and I think this gets to this, this term resiliency. We can't get lax about it. So I like to use that TSA type approach. Until March, I was a frequent traveler. And even with all the frequency of traveling and having, TSA approval and all, I still get pulled out of line periodically. I still get checked. And I think you have to do that too in the workplace. We can't get really complacent that it's going to be the same process day after day. You have to mix it up a little bit. You have to pull people out of line. You've got to do some random checks. We've got to really keep people on their toes. And I think, although it may seem an inconvenience, I think the respect that organizations will have on really trying to keep things fresh, keep things, different, making sure we're staying on top of it, will be well received. And that's what we're seeing across the board.
So really it's about being diligent in protecting your employees, and they'll appreciate the fact that you are. Awesome. All right, I said it again. Sarah, we're going to get back to you on how waves 2, 3, and 4 are different from what employers are generally need to manage regarding employee population well-being.
Sure, that's a great question, Laurie. Thank you. So as we know, in these second and third waves, we expect to see an increase in chronic disease, suboptimal management, as well as the immediate impact of resource restrictions. So what we've seen during the immediate term of the virus is that we had people deferring a lot of care. Primary care, elective procedures, dentist visits, hip replacements, you name it. We know that services went down across the board, including visits to the ED, visits to otherwise, safe type of locations. We even saw decreases in cancer care, which you would think, was unexpected, even from our perspective. So if you move to the next slide, we'll start to see how that might impact us. We know cancer screenings decreased nationwide by about 90%. Particularly breast cancer and colon cancer went down. But one statistic that's even more shocking is we saw a 90% decrease in lung nodule biopsies. So those are people who had some sort of concerning lump in their lung or cyst, and we're delaying even the biopsy to know what it is because our hospitals have been in such crisis. So what does this mean for an employer or even at the patient level? Is that once we resume these screenings and once we resume these services, we'll start to see people with new diagnoses and potentially of even more progressed disease than had we caught something 6 months ago. When we started out, we all thought, you know, we'll turn off the mammography machine for 2 months while we focus on this virus and we'll have it back up and running. Now we're in month 5 and it looks like we might be going into even a 9 or 12-month situation. So imagine the impact across your employees if you've got someone with a breast cancer diagnosis or a lung cancer diagnosis that's coming a year late. Then it's a much more significant disease and something that we should all be concerned about. On the next slide, we've got another example, particularly related to diabetes. So the black lines that you see here is the rate of weekly hemoglobin A1C tests for diabetes diagnosis and screening, most commonly type 2 diabetes, which is what really impacts employers. In the weeks following the outbreak, the number of hemoglobin A1C tests across the nation, they remain at about 40% of pre-pandemic levels. So even though we have developed safe ways to get to the lab, we've started to reopen our primary care clinics and our urgent care clinics, we know that patients still aren't getting these screening tests for diabetes. And further, we know that they're sitting at home, less active, and potentially snacking more. So we're starting to see data come out that basically this pandemic means a 0.5 point increase in hemoglobin A1C. And a one point increase is essentially going from controlled to uncontrolled. So this pandemic alone is getting somebody halfway from controlled to uncontrolled. So this is something that we'll have to deal with as we start to reopen too, that we'll have diabetics who were potentially not tested, or if they were tested, they're starting to get results and numbers that are not as good as they were pre-pandemic. Very concerning.
All right, so I have to say, in COVID-19, the 19 really does represent the 19 pounds we're all gonna gain before this thing is over with. Just put it out there now.
That's right.
Yeah. All right, Tony, you are up next. What can employers do with the 3 additional waves that are now upon us? And I almost want to call them tidal waves that are now upon us.
Thanks, Lori. And just to transition, one of the key points that's been made by several of my colleagues earlier is the impact on behavioral well-being, either people with behavioral health conditions already or people who are developing new symptoms and risks. And some of the great information that Sarah found is the drop in actual care as measured in first-time prescriptions of medications for people with behavioral health. So not only do we have the factor of risks increasing and prevalence increasing, but people actually getting care decreasing, so a double whammy. So from an employer point of view, we put this in perspective from the view that all of us are striving to improve well-being for our populations. And that's really all about a focus on an ongoing basis of getting the right people for the right resources at the right places at the right times, and to having a very high success rate in doing that. And what Sarah just described are 4 very daunting challenges to being able to do that. It's not business as usual anymore. We're trying to manage people through cases with COVID and after effects, as she described. We're trying to deal with people who have deteriorating health status from musculoskeletal or cancer conditions that haven't been managed. And we're also trying to support people with chronic conditions and behavioral health conditions that have either been serious and high risk to begin with or are getting that way and are potentially getting worse. So all this, as we said, is a very significant challenge. We're not here just to throw a challenge at people. We're here also to provide some confidence that there is a way through this challenge. We at Hopkins and Agile believe strongly that, fortunately, there's a roadmap for success and for achieving organizational resiliency around this goal of getting people to the right place with the right resources at the right time. And it's been well proven over the last 20 years as something that everybody can follow now. And I want to start by acknowledging that it's been proven because what we've seen and what our colleagues have seen is a very significant gap between what we'll call world-class performers and average performers on almost all metrics of outcomes, whether it's related to cost or employee well-being, employee retention, absence, work days, whatever it is, that there is a big gap between great and good. And ultimately that comes out in the rate at which, the success at which organizations have been able to get the right people to the right resources in the right place at the right time. So what we've learned over the years is this success hasn't happened by accident, that it's really been about a focused effort over time, a continuous improvement process, as Joe would say, for the world-class organizations to figure out what works and to perfect it and keep practicing it. And so we've shared in the document beforehand and are sharing now is a simplified view, if you will, of what is it that actually leads to world-class outcomes and achieving vitality, organizations with vitality in the face of these second, third, and fourth waves. An environment where we've seen just recently in the last couple of weeks, forecasts that the impact of the second, third, and fourth wave may have an 8 percentage point to 10 percentage point impact increase in healthcare trend and a concomitant reduction in well-being. So our perspective is that now's the time for all organizations to focus on how to get from good to great. And what we want to talk today about is both why we think that's true and also how to make it happen. So I'm going to turn it over to Joe and Stuart now to talk a bit about their experiences for why these requirements or key factors for success work, why they're important, and then we'll talk more about how each employer in their own way can bring them to life successfully if they haven't already. Joey?
Yeah, thanks, Tony. And I would just remind everyone that again, I am a long-suffering benefit executive, and I've been around the block a little bit. And in my career, I've had the opportunity to, on a couple of occasions, to work with management, to work with the organization, and deploy all-embracing health and productivity initiatives. And you know, the first time I did that, which was almost 20 years ago, I think it's fair to suggest that that was widely successful. And I would look at the factors that have been listed here, and I'd point to all of them, but there's an overarching factor, and that is leadership. In my first attempt at deploying programs that would improve the health and well-being of employees and creating a culture of health, the CEO of the organization got it and owned it and embraced it and built into the organization fabric, the fabric of the organization, the needs and the requirements. Myself and my team were the functional experts. We drove the agenda. Again, we were the center of excellence, if you will, but the leadership of the organization was paramount in terms of creating success by driving the right attention on the right things by all aspects of the business. The second time I tried to replicate this, not as successful. We did a lot of great work. I think that parallels what a lot of other organizations have done. A lot of great work, but we didn't achieve what we set out to achieve. And a big piece of that was because, and I take ownership on that, a big piece of that was because we didn't have the organization fully focused. We didn't have leadership on board. And so I would suggest, as I look at these factors, they're all important. You know, your vendors are critically important, but they're not your solution. You're the solution. Your organization and your leadership is the solution. This has to be about the whole organization. And so as I look at these 6 criteria, I think they're the right ones. And in combination with your senior leaders owning and driving this with your expert opinion and guidance, that's how this can work and be successful on a go-forward basis. Stuart?
Yep. Yeah, and I think I'll just say quickly, really putting together a kind of whole approach to this. What we're seeing is, and what the data tells us, is really starting from the behavioral health perspective. There's lots of programs out there that say, oh, this person should be in a diabetes program, or this person should be in this program. But oftentimes the success isn't there. The sustainability is not there. And why is that? And so from our experience with our own employees, we actually run our own health plan at Hopkins. So we have about 60,000 members on our own self-run plan. But then obviously from our clients' perspective, meeting people where they are and finding out what other issues they may be dealing with. Again, many of them behavioral health related, and trying to address those first really allows you then to take a more integrated approach to condition management by kind of tackling some of the other challenges to then focus on the specific disease itself. And it's really been very beneficial. Tony, anything to add to that?
Yeah, very quickly. Thanks, Stuart. I think a key point for the Hopkins and Agile team is that well before the pandemic struck, we've been delivering the message that improving individual well-being is probably the most important strategic initiative that any organization can take, in terms of it being the right thing to do for its people, obviously, but also the right thing to do for its organization. And there are other organizations out there who have done the research, like our colleagues at Health Next, to validate that bias. That our friends at Health Next have developed a 1,000-point assessment that helps organizations understand how well they're doing on these types of success factors, and able to show them a roadmap, as we said, to getting to world-class on those factors, and have validated that by progressing on that roadmap and effectively increasing score on that assessment, that there's going to be a representative decrease in health cost trend, and an increase in population well-being and residual value to the organization in terms of productivity and engagement and all the other factors that we're trying to drive as human resource professionals. So we believe very strongly in this roadmap, and would like to talk a little bit more. I'll turn it back to you, Lori, about just how to make this real.
Great. All right, so we're actually going to turn it over to Joe, the elderly former global benefits leader. As that former global benefits leader in large organizations, what would you do now, given the opportunities and challenges our employers are in the midst of the pandemic, and what the waves and the future waves? How would you handle it if you were doing it today?
Yeah, thanks, Laura. And I think that's a great question. I guess I'd start by saying, I have some ideas about what I would do, but again, every organization is different, and the roadmap for every organization needs to be different. But the very first thing I would do, because a lot of this is information that, everyone's familiar with COVID, where we all know what's at a high level, what's going on. We all know that the challenges that the country's going through. But we're the professionals, and I think we're the first ones to really appreciate what the second, third, fourth waves, what all of that really means, and what the implications are for our organization. So the very first thing I do as a benefit leader is I make sure my management's up to speed and they fully understand this. Again, my point of departure is that I can't be successful without management, and so I need to keep them in the loop. These are implications for the health and well-being of the employee population. There are economic implications for the organization, and this is coming. And whether it's in 4 months, we're going to start to see it, in 2 months, or in 8 months, this wave is coming, and we need to be prepared for that. So, as what would I be thinking about if I were still sitting in the chair? The very first thing I'm thinking about, and I go back to my position as with my focus on whole person well-being, very first thing I'm focused on is mental health, emotional well-being, because I know almost every organization that I've spoken to, people, they've sent out communications. If you're not feeling right, you know, there's help available, call EAP, and nobody calls EAP. And people are struggling out there, and it's going to get worse. Fatigue is going to set in. We've been at this for a while. Wait for the cold weather when people move back inside. Wait for the autumn when the regular flu emerges on the annual cycle. And so I would be out there looking for a proactive behavioral health program that's going to help me ferret out what the issues are in the population and direct people to care. I think that is absolutely the first thing I do. To Stuart's point, we start with the emotional well-being of people, and then that gives us an opportunity to go to other places. Also, I'm a Six Sigma guy. I'm data-driven. I want to look at the data from my organization. I want to understand really what the needs of my people are. And I want to get that information on a couple of different levels. I want to know from a broad-based clinical perspective, the profile of my organization, where should I be allocating resources? And I want to challenge the team. I want to challenge the vendors to identify the specific people who have these needs, who are going to be the emerging problems down the road. We know from the data who's had their appropriate cancer screening or not. We know who's been taking their meds. We know, right? We know. And so we need to ferret out that information. I'd probably pause there, take a breath, and then that's a joke, Lori. I'd probably pause there, take a breath, and then I would also think in terms of a vendor summit. Again, I don't think we can turn this over to our vendors. I think we have to own this and drive the actions and activities, but they need to be part of the solution. They need to be on board with our near-term reaction to the waves, and they need to be supportive, and they need to integrate their activities at my direction with the other vendors. This can't just be they're doing their own thing because that's what they want to do. I want to get my communication team together, and I want to seek out from my leadership group people who can deliver messages to the employees, high-level messages about how they're struggling, what their issues are, because I think setting the example for employees, and then those employees receiving outreach and communication, I think sets the table for those employees to be more responsive and more willing to accept the help that's going to be offered up to them, and to acknowledge that potentially they have issues and there are things that are going on. And then I would pivot. I would suggest that for years and years and years, the benefit folks have been screaming about the health of populations and about the opportunity for organizations. And in a few instances, that's been heard. In a number of instances, we've been given, quote unquote, permission to do a few things that we wanted to do around traditional wellness and what have you. And quite frankly, we've sub-optimized and we haven't achieved. And right now, there's a burning platform. COVID has awakened us to health disparities. It's awakened us to the real practical implications of our workforce not being healthy and what can happen to them if they're afflicted with COVID or some other disease. I mean, everybody right now is focused on healthcare, and now is the time to come back to the organization with proposals around and an education process around what is the realm of the possible. And this gets to where Tony was in terms of organizational transformation. What is the business opportunity? At the end of the day, these are employers or businesses. So what is the business opportunity? What does that look like? What will it take to get there? And I think as benefit leaders and business leaders, it's incumbent upon us to not just engage the C-suite. I think I found some of my greatest personal success in working with people at the second and third and fourth tiers in organization to help them understand what the issue is and what their role is. And they become champions, because for an organization to be successful in terms of achieving the improvements that are possible, it has to become part of how we do business, and everyone needs to be involved. And so I'll leave it there in the interest of time. But I get it, on the one hand, this is a tremendous human tragedy, and it's heartbreaking to see what's going on. On the other hand, I think it really is incumbent upon us to leverage this opportunity to make things right on a go-forward basis, and to really begin to elevate our game. Lori?
I completely agree with all of that, Joe. Ultimately, employers and benefit professionals have to really take the lead in taking what this sad situation is and creating an environment that's amazing for the associates or the employees and their families. So, and we can't forget about families. So that's my 2 little cents
That's right.
pitch there. With that being said, Stuart, tell us more about how Johns Hopkins evidence-based research and what you can do to inform employers about what types of programs and resources they need to implement.
Yep, great. And I will keep this short but to the point. This is a great example right here based on data that we run at Johns Hopkins. So this is looking at a population of employees and dependents within an organization and looking at the additional cost that is related to moderate to serious mental health or substance abuse issues. So just take the diabetes, for example, over on the far right. And you see that, as we know, a typical diabetic who's doing everything by the book, getting to their doctor's visits, getting their insulin, they're going to cost a health plan somewhere between $10,000 to $12,000 a year on an ongoing basis. But if unmanaged with some of these other conditions that we talked about, just look where the costs skyrocket. And so how do you start to address that? And that's why the point I made earlier, that you just can't, take somebody and say, hey, because the data says you're a diabetic, throw you into a diabetes program and expect success. So if you go to the next slide, Laurie, there's a whole approach to this that Hopkins developed actually in the early 1900s, and it's kind of the gold standard for really triaging people, and it's called perspectives. And the perspectives approach, instead of just saying that mental health is something in the brain, it's really a disease that has to be looked at not only from how it's affecting you mentally, but also what is it doing to you from other behaviors? What's your life story? Let's look at personality traits. How do you really look at the whole person and then describe the right pathway? So if you go to the next slide, a lot of what we really talk about is building that pathway around assessment, around education, and then around triaging them to the right place. One of the things that has been a challenge too is the lack of mental health resources, as we all know, in our country. And oftentimes we think it's a win because we took somebody and got them to a therapist. Well, that's not necessarily the case. If somebody needs help because of an eating disorder, getting them to a therapist who has a specialty in, family care isn't the right person. So it's even more severe than just getting them to help. It's getting them to the right help. I think that's a lot of what we can really focus on. So the last 2 slides, really focus on, how do you look at a whole person approach and what's the impact in managing that approach? And last slide is really then taking and really putting together kind of a personalized health engagement process. And let's not forget that there's really unique things out there today. I mean, we've seen the huge surge in telemedicine utilization. We've seen the huge surge in using things like AI chatbots for mental health, virtual reality to help people with chronic stress and conditions, different mobile applications. So it's even within your own organization, it's not a one size fits all. You got different age, sex, all types of things to think through. How do you take all these and put them together for really the best approach? Laurie, back to you.
Fantastic, thank you. So Tony, from your perspective, working with many organizations throughout the world on cultural and organizational transformation, what guidance can you provide to the audience?
Thanks, Lori. I think to start, just to summarize what my colleagues and I have been saying, if we think about the second, third, and fourth waves, what we're talking about is
Tony, I think we lost you. Are you there?
substantial increase in the number of, hello?
Hi, Tony. We
Yep.
kind of lost you for a moment. Would you mind?
Oh, okay. Yeah, no, gladly do. It's funny. I just got this message now. Your internet connection is unstable, so I'll gladly start again. So where I wanted to start, yeah, right, exactly. Thank you very much. So
That's the
where I
only
wanted
thing
to-
unstable.
There you go.
I was thinking that. Never mind.
I know.
Never mind. Too much familiarity here, sports fans. Anyway, where I wanted to start was just summarizing what my colleagues and I have been saying so far about the second, third, and fourth levels. That effectively what they represent is a substantial increase in the number of people who are going to have very high risks, very high needs, and very significant levels of support for care. And that succeeding in supporting people and maintaining organizational resilience is about how to support those people with the right resources at the right place at the right time. And so one way of looking at this is it's basically a market share game. If book of business average, if you will, is getting 4 out of 10 of the right people, the right place, and the right time, and world class is 9 out of 10, and we're going to go from having 20% of our population to 40% of our population being at high risk and high needs, just as an example, then moving from book of business average to world class and being able to get that market share, if you will, of right people, right place, right time, is absolutely critical. So the organization change, cultural transformation that we're focused on is what we would call the requirements for making well-being improvement a key strategic imperative in the organization, part of everybody's job, because our perspective is, as demonstrated by our experience and experienced by Health Next and others, is that's the only way to win this game, to get the world class, to win the market share game, to support people when they need it, where they need it, how they need it, in a way that helps them and helps the organization. So with that in mind, we can talk about culture and transformation, organization transformation is basically, it's new ways of how we do things around here in an organization, how we do make it a strategic imperative and part of everybody's job to improve well-being. So we can think about it in terms of what, why, how, and when. The what is, it has to be explained in very tangible, practical, understandable terms for everybody in the organization as to what success is and how they adapt either as an individual, consumer, if you will, or within their job, and how they contribute. This is going to be very new to a lot of people in the organization, and it's something that's going to take a lot of effort to make them understand, aha, that's what this is about, this is what's expected from me, this is how I can succeed. Also, to make sure that it's understood that it's not an elective for anybody in their role in the organization. A lot of times people think that being in neutral, like not being an impediment, but not being supportive is okay. And it's not okay. That this really has to be something that people take on as tangibly as possible for their own job. And a very quick point is the difference between a culture of health and healthy culture is more than semantics, in that a culture of health can be viewed as, oh, that's something that HR does, that's their initiative, or that's something the benefits folks are doing. I don't have to pay attention to that. Whereas if it's known throughout the organization that we have a healthy culture, we're focused on a healthy culture the same way we're focused on a safety culture, it changes the dynamic. Around the why, it's absolutely eliminating the beliefs that making well-being improvement a key strategic imperative is a distraction or an inappropriate imposition. People saying, I don't have time to do that. I got to get the work done. No, don't bother me with doing this stuff. I got to get the work done. Well, I think the point is there are ways to get over that and eliminate those beliefs with 2 different levels of messaging. One is a corporate call to action from leadership, as Joe described so well. But the other is creating the what's in it for me at both professional and personal levels within the organization. One of the greatest successes I know Joe had early in his career when we were working together was explaining to line managers how they're supporting chronic condition management and multiple skeletal management programs would have a tangible impact on their unit costs and unit quality by improving people's ability to do their job and show up for work. And when all of a sudden managers saw the impact on their bottom line, on their incentive compensation, my heavens, did they get religion. And then similarly figure out how to deliver messages to people on a personal level for how they would see the value of taking more responsibility for health and well-being. So the when and how are about really the managing the pace of change and recognizing that organizations can't change any faster than individuals can. It's sort of obvious to say it, but it's amazing how many organizations will make mandates or make policy changes and almost set up a sort of social Darwinism situation. Well, here it is, good luck. Whereas really the success is in managing the pace around individuals' readiness to let go of old ways of doing things, old beliefs, and be in a position to actually be supportive and contribute to organizational change, borrowing from William Bridges. And that effectively in doing that, the goal is leave no one behind, if at all possible, and plan how to support individuals to get to, as William Bridges would say, new beginnings. To do that, I think two things. One is make it as human as possible. Use the relationships that exist within organizations, the positive ones that already exist, foster new organizational positive relationships, role modeling, mentoring, peer support, champions. I put the 400 here. It's one of my favorite examples of an organization, 500 employees, 5,000 employees, has 400 volunteer wellness champions that are organized and mobilized throughout the organization every day. And then finally, it has to be a compelling process, sales and communications process, to build market share. To those of us at Agile and Hopkins, this is consumer marketing the same way selling soap, Coca-Cola, and sneakers is. You're trying to win the hearts and minds of consumers, to do things differently, to be committed to new approaches, and to take action in positive ways. And so communications have to be very visceral, very constant, multimedia, and most of all, authentic and ones that'll reach people. So I'll stop at that, Lori. Back to you. We lose Lori now?
I sounded brilliant right then. You just didn't all hear me putting it out there.
Okay.
Bless you.
I was going to say, what I was saying was, you're right, Tony. It's as much a marketing initiative as it is anything else in an organization, because you are promoting that healthy culture to your employees, and you want them to be to their family. So I completely agree with you on that. And then before we respond to questions, does any one of our wonderful panelists have any closing thoughts?
Joey, I might defer to you.
Yeah, Lori.
If you do.
I'm sorry, Tony, say again?
I said I'll defer to you, Joey.
Yeah,
Oh,
and
Joe, he was asking you.
Yeah. So what I would say, and hopefully I'm not on mute. Nope, I took myself off. You know, Tony and the team have done a pretty good job of describing, you know, what's going on and what some of the issues are. And I just want to reiterate, so that we leave at least 74 seconds for questions. I do want to just reiterate that, look, there's a train coming down the track at us with the multiple follow-up waves, and that business as usual is absolutely not going to get us through this period that's coming at us. You know, I think about back to my Six Sigma background, and one of the things that Six Sigma taught us was always look outside your industry, look beyond your industry to see how other people are doing, because your only reference point as benefit professionals, for most of us, our only reference point is looking at, you know, what goes on in our world. And our vendors love to tell us about how we're doing against benchmark. I got to tell you, ladies and gentlemen, benchmark is crap in our industry, and we really need to look beyond that. We need to understand, how do we go from benchmark, which has not served us very well for the last 30 years, to world class. We need to break some glass. We need to change the paradigm. So we need to challenge ourselves to do something a little bit different. Unfortunately, COVID-19 has given us a burning platform. And quite frankly, I think now is the opportunity for us to step up, to step forward, and to begin to drive the organizational and cultural changes that we can drive and that can make a meaningful difference. And I think I'd leave it at that, Lori, and hand it back to either of my colleagues or back to you.
Thank you so much. Does anybody else have any last closing thoughts before we move forward to questions? And just know it is the top of the hour.
No, ma'am.
All right, if anybody will stay on for just another moment or two, and if anybody has any questions, please drop them in the chat box. Let's see what we got going on here. We have excited for the presentation. Thank you. And we have excellent presentation. Love the panelists and the information. So neither of those seem like questions to me. We'll give it just another moment in case somebody's a slow typer. All right then, I do not see any questions at this point. Wait, maybe, am I lying? Yep, it was this is great. All right, so at this point we will wrap this up. Thank you all very much for participating, not only the panelists, but the folks who decided to attend today's call. I hope you all are doing well, stay safe, and we'll see you at the next HR Company Store Vendor Showcase. Thanks and have a great day, everyone.
Lori, thanks
Lori.
so much for hosting us. Much appreciated.
Thanks, everyone.
Thank you so much for joining us. Much appreciated. Everybody take care and be well.
Take care. Be well, everyone.
Yep,
Take care
bye-bye.
now.